The spread of the H1N1 virus seems to have calmed down some, but health experts warn now is not the time to be complacent. Margy Wienbar with the New Mexico Department of Health joins us with more on that. Thanks so much for being with us.
Good to be here, Mike.
Everybody seems to be relaxed about it, and lately we've been hearing, don't get relaxed because this next wave could be even more severe. Is that the way you look at it, too?
The way we look at it is based on history. When we've had pandemic flu in the past, we've seen it come in 3 waves. And we saw the springtime emergence of the novel virus. We had a fairly significant outbreak this fall, and then we're anticipating potential for another outbreak or another wave of the virus come later this winter.
And we did hear a lot about the virus or the vaccine shortage early on, but that's not the case anymore.
No, we have plenty of vaccine. We can order more from the CDC. Our intention all along was to have enough vaccine to vaccinate anyone who is interested, and we're at that place. We're really working hard to make sure that anyone who wants vaccine can have it, and in hopes of really mitigating that 3rd wave.
And of course that means trying to get those kids vaccinated, and you and APS have been trying to get into the schools, and that started this week.
That started this week. We had some pilot schools, and it's gone amazingly well. The APS principals, nurses, and staff are working with our staff to get those clinics scheduled. We get there, we vaccinate as many children as quickly as we possibly can. It's been really fun for our staff to get out and be working in the schools.
Is the concern over the vaccine, has that tapered off a little bit now with parents who are concerned about the health of their kids getting a vaccine that might make them sick?
We've had a lot more experience now. We've given millions of doses of that vaccine, and we've seen very few reactions. Even I know that in our region we've seen very few reactions to the vaccine at all, other than the normal reactions you might get from a sore arm from the injection site.
Now, if parents don't have a child in APS, there are other venues for them to get the vaccine, correct?
Absolutely. Our local primary care providers are still giving vaccine. You can call your doctor. Our local public health offices are still giving lots of vaccine. We have clinics scheduled every week. People can call Albuquerque 311 in the Albuquerque area, and they'll be directed to their closest local public health office, and we'll work very hard to get you a vaccine if you're interested.
And there's a statewide number as well, 1-877-304-4161, and people around the state can call that number.
That's correct, if they have questions in particular about H1N1. We're working with APS, as I said. We've done about 8 schools this week, and it's gone very well. We have the forms up on the APS website, so the parents can go there, look at the forms, print them, and get them filled out in their homes, and then send them with their child to school. We'll be publishing a schedule as soon as we have that available on the APS website.
Been a pretty good partnership so far, then.
It's great.
Okay, Margy, thank you so much for being with us today.
Thanks, Mike.
Really appreciate it.